Hi everyone, Emily from ARC Seminars here. A question we often get asked, especially in our Edema Management course, is do you use Kinesio tape for managing swelling? And the answer is all the time. Kinesio tape is a low risk way to put on your patient, help manage swelling, especially for areas that are hard to reach, that really need that extra care. It's kind of like a way of sending your hands home with the patient, as I like to say. So it's something that you can do, you can put on the patient, and it's a set it and forget it thing. The Kinesio tape can be working as they move all day long. So I'm going to show you a couple of techniques here that you can use Kinesio taping to manage swelling for your patients. Kinesio taping for knee swelling is a great way to use this modality. The knee is constantly moving when the patient is walking around, and thus the Kinesio tape can work really well. I use this for when my patient has swelling around the knee, such as from a surgery, from joint effusion, hemarthrosis, or if they have fibrosis and swelling in the popliteal region here, the Kinesio tape can work really well. So I'm going to show you how you would cut and design your Kinesio tape to get the best use out of it for the knee. Firstly, you want to measure your tape. If I was treating for, we'll say, a total knee replacement, and I want to bring the swelling that is getting caught here up to the inguinal region, I'm going to measure my tape from here to around here. Cut your tape and make sure that you round the edges at the top. I then like to cut my tape into 4 strips. Leaving a pretty wide anchor at the top. The way Kinesio tape works is that the elastic tape sitting on the skin mobilizes the skin, and it's similar to manual lymph drainage with your hands. Moving the skin during mobility actions is going to help move superficial lymph that is in the skin and superficial tissues back towards deeper node beds. That's why the anchor of your Kinesio tape should always be close to a node bed, while the tails of your tape will span the edematous tissue. Once you have your tails cut out, round those edges too. This will help the tape from getting snagged and caught on things, and may help it stay a little longer. Make sure you prep your patient's skin. I've already prepped the skin with alcohol wipes, but you want to make sure that any excess oils or lotions have been removed from the skin. If your patient has a very hairy skin, this may not be the best modality for them. However, you can still give it a try and see if it works for your patient. What I like to do is take off the anchor first, as you can see. I remove that paper backing and tear just at the top of where the tails are. The anchor is going to go towards the inguinal nodes. So that's right up here at the hip. We don't want it to go all the way, as there's a lot of, clothes, etc. that can get caught. But we're going to put it right up here in that direction. Give it a rub. We want to warm up the tape so that it'll stick better. Now you can work with all the tails separately so that they don't get caught up and tangled with each other. A lot of lymphatic drainage occurs in the medial knee as opposed to the lateral knee. There's far more proliferation of lymph vessels here than on the other side. So I'm going to focus 3 of my tails here and 1 on the lateral aspect of the knee. It is really important when you're taping for swelling not to put any tension on the tape itself. As you can see, the tape can stretch, but we don't want the tape to stretch when it comes to swelling. Instead, we want the skin to stretch. So you can take off the paper and begin to lay this down. When you get to just above the knee, ask your patient to bring their knee back so that the skin is as stretched as possible. In your patient post-knee replacement, that may be only to 90 degrees or so, but you can get them to do what they can do. I then lay the tape down with no stretch and rub it so that it warms up. I copy the procedure with my next tail, laying it down with no tension, including at the tip here, no tension at all. The third tail is going to follow the same direction. And for the last tail, I'll bring it along the lateral aspect of the knee. It has lesser lymphatic drainage, but it does still have lymphatic drainage. Once that's been completed, have your person bring their knee out again. When you can see little wrinkles in the tape as they move their knee, you know that the taping is doing its job, because those little wrinkles are pulling up the skin. And what that does is, as the person moves their joint, the tape is pulling up their skin and moving the superficial lymphatics. So as you can see here, that has the desired outcome of a lot of wrinkles. As I said, this tape can stay on for several days. It can get wet. Your patient can bathe with it. And if they need to take it off, generally rubbing oil or lotion on top can soften up the adhesive and makes it a lot easier to take off. So this is one of my favorite applications for Kinesio tape of swelling of the knee. I hope you enjoyed it, and if you want to see more applications of Kinesio tape, check out our other videos of Kinesio tape applications for the hand and the foot.